Okay, so we're very pleased tonight to welcome Dr. Martin Haulena, who's called Dr. Marty by his colleagues. He's going to speak to us tonight on health issues that could be interfering with the recovery of the small, vulnerable population of southern resident killer whales. He's also going to touch on health concerns of other marine mammals. As Dr. Marty will tell you, he is a veterinarian, he's not a marine biologist, but he does have a pretty darn good idea of what's going on out there that's affecting all of our marine mammals, whether it's left behind fishing equipment or polluted water or whatever. He knows what's going on. Excuse me, Dr. Marty is a graduate of the Ontario Veterinary College, and he has a master's degree in pathobiology from the University of Guelph. He's also a diplomate of the American College of Zoological Medicine. He's currently the head of the head veterinarian at Vancouver Aquarium, but he's also the executive director of the nonprofit Vancouver Marine Mammal Rescue Center. He was a staff veterinarian at the Marine Mammal Center in Sausalito, California for 9 years. There's a special interest in innovative diagnostic methods, developing safe anesthetic protocols, and improving surgical techniques. He conducts clinical and basic research on marine mammals and is actively involved in the preservation of endangered species. Now, if you saw the email that I sent out before we had our poster, you'll be aware that Dr. Marty and his team from the Marine Mammal Rescue Center were the subject of a short series, I think it was just 3 documentaries called Wild Pacific Rescue. They're well worth watching. If you Google, you'll see several different ways of finding them, including on the Love Nature channel. And you'll get an idea of the lengths that they go to, including trying to dart a stellar sea lion from a zodiac in order to rescue a stellar sea lion and olive ridley sea turtle, which really shouldn't have been up here, and other creatures large and small. In his work at the aquarium, Marty deals with everything from large critters to bats. So he does a lot of different stuff, and he's a very interesting man. So I'll turn it over to him. And I see 2 more chat things here before we continue. Lisa saying congratulations to the elected officials and also thanking Sid. So I'll turn it over to Marty now.
Well, hi. Thank you for that awesome introduction. That's going to be a lot better than my actual talk. So I'll try my best here. I'm going to try and share my screen to begin with. Let's see. Does that look like a title slide to you guys?
Looks good.
All right. That's cool. And you can hear me okay?
Yes.
Awesome. Good evening. I enjoyed listening to the minutes. I didn't realize how involved everybody is and all the different things you do. That's kind of exciting. I'm just here in Point Roberts, so I can probably wave at most of you guys from my house. I think you're all rather close to where I am. So I actually have kind of 3 stories on killer whales this evening, so it's going to be very killer whale focused. I have to admit some of it is a little dry, so I apologize for that. But it's 3 kind of oh my gosh, I shouldn't have drank my wine so fast. Or I should have drank it faster, I guess. Just 3 stories kind of highlighting some of the studies we've been recently involved with in killer whales. So I hope they're not too dry, but we'll go ahead. So the first study really is involved in looking at skin disease and indicators of killer whale health from the outside. So you have to imagine, and this is mostly to do with our southern resident killer whale population, which is, as you know, a highly endangered population of killer whales, and they're kind of the ones we see here in the lower mainland mostly when you're out whale watching. There are only about 75 of these individuals left. That number kind of goes up slightly, down slightly. There was a calf born just a few days ago, maybe up to 10 days ago. So every calf is of interest. Now, we don't get a whole lot of opportunity to get our hands on killer whales, particularly this endangered group of animals. So when we're looking at health concerns, a lot of our kind of data comes from things from afar. So photographs, for example, and that's kind of the highlight of this talk that I'll give here, or this sort of section. And I have to say, as a clinical veterinarian, it's very, very frustrating. People always go and send photos of this, that, or the other thing on a killer whale and go, what's wrong with this animal based on what its skin looks like. And it is very, very difficult to draw some conclusions there. But as we'll go, the amazing part is that there is actually a huge amount of data, and it's not totally unheard of to draw conclusions about the cause of a disease based on a lesion in the skin, nor associating it with higher levels of morbidity or mortality. So looking at a few past studies that have kind of taken this approach, there's been studies in bottlenose dolphins, guana dolphins, minke whales, and North Atlantic right whales. And for example, in 2012, Hart et al. Published a paper doing some regression modeling, looking at skin lesions, and found that there's a significant reduction in the odds of lesion occurrence for increasing water temperature. So kind of linking things and environmental changes for animals living in certain parts of Georgia. This study, based on animals from 1980 to 2002, show these swath lesions in North Atlantic right whales, and often associated with a fatal condition. So animals that had these kind of lesions on them resulted in mortality more often than not. So all 6 whales with swath lesions had either been entangled previously or were entangled in fishing gear when the lesion appeared. So, and 4 of those 6 are either known to have died or suspected to be dead. So a significant lesion may be associated with an actual problem like entanglement. So taking photos and looking at lesions, and there is some I guess possibility that might reward us with some information into the animals that we deal with. So these are called expansive annular lesions in Chilean dolphins, also associated with potential mortality, and that was from a 2015 study. So again, super frustrating with our group of animals that live here, because as a clinical veterinarian, when someone brings me an animal, or I see an animal and it's want to figure out what's wrong with it, I like to put my hands on it. I want to listen to it. I want to take blood tests and imaging like crazy. I actually want to find out what's wrong with it. So the sort of dealing with whales, particularly free-ranging whales, is super challenging to the way I approach medicine. So, but it is incredibly awesome to be involved with these animals, and have been now for several years. So this particular study I was involved in essentially looked at data that had been collected for about 13 years, 2004 to 2016, on our southern resident killer whales. So we chose for animals that had good resolution, good lighting, looked at 5,463 images. So most of these images come from the Center for Whale Research, based in Friday Harbor on San Juan Island. They focused on 125 animals. As you know, our southern resident killer whales, or you may not know, have 3 pods that make up that population: J, K, and L pod, and that's kind of the naming scheme for the animals that are in there. So like J50 is the 50th animal born in the J group, that kind of stuff. So 38 Js, 26 Ks, and 61 Ls made up the 125 animals that we looked at. Essentially, what we did is gather 4 of us yahoos into a room and look at, 5,463 pictures together, and score everything and come up to agreement to figure out how to classify skin lesions. And all of this based on the idea that if we had a collective way of looking at and standardizing skin lesions in this group of whales, we might be able to draw some conclusions on population level health issues, or what caused the lesions, or if they're even important or not. So in that group of veterinarians was myself, was a clinical veterinarian from SeaWorld who'd been working with killer whales for eons, Hendrik Nolens, a veterinary pathologist from the zoo and aquarium world, who'd also worked with a lot of SeaWorld killer whales, veterinary pathologist from British Columbia, Stephen Rafferty, who works with examines all of our animals at the Marine Mammal Rescue Center, of course, any animal that passes away at the Vancouver Aquarium, but also deals with all the wildlife that strands dead across British Columbia. He says 4 veterinarians, but there was actually 5, and the 5th guy is Dr. Joe Gatos, who's a really good friend of mine and compatriot who lives on Orcas Island, who heads up Sea Dock Society, which is a really cool society dealing with free-ranging wildlife in the Salish Sea. So anyway, so we scored the 4 veterinarians, or we didn't score the 4 veterinarians because they would have gotten a really low score. We scored the lesions, all 4 of us did. In the end, we found that there were 6 unique lesions that we found. 2 were probably normal conditions, so I'll show you those: fetal folds and calf sloughing. And you're going to see that the names of this stuff is ridiculous, what we finally came up with. So, there were actually, could be 1 lesion, there could be up to 4 different lesions per image. So let's just start into this. And I tell you, it is not super super exciting, but here we go. The end result is kind of cool, so bear with me here. So this is really exciting. We call this gray patches. All right, that's how technical we got. That's how descriptive we got. So gray patches is a lesion that we saw, and the way we described it is either multifocal or multifocal extensive gray discoloration. They can appear sort of targetoid, as in you can see that kind of light gray patch with kind of a darker center. Right, so sort of a target lesion, like a bullseye lesion, right? And they can kind of get that later on in progression. These lesions were observed out of 5,460 observation days. Somebody saw at least 1 animal at 98% of the time. So extremely common, right? Some of these are sort of described like tattoo lesions, like some artistic, a guy from a Main Street or whatever, kind of tattoo sort of thing. Great. Now these, sorry. So these gray patches are, yeah, that's what they are. Gray patches, right? Blah. They're even boring me. The next lesion is gray target lesions. So these are multifocal, as in there are many of them, to coalescing, so those things can join together. Lesions that have curvilinear or serpiginous or like snake-like waving margins. The margins are super well delineated and can progress into kind of gray patches. So that's what we're talking about here. I can sort of draw that circle for you again here. And then that was the second most common lesion seen and sort of correlated with the gray patches. So likely associated, if not kind of a variant of the same lesion. But anyway, we have to kind of describe it as a different thing, even though we think it's kind of part of the same idea. So gray target lesions, right? And then, and they do kind of resolve. So this is or reduce or progress. So this is a lesion. This is the same animal, October 20th. And then so October 18th, October 20th, they do kind of progress, right? And then 2 days later, you'd get these kind of multifocal pinpoint black erosions can be seen with peripheral, the kind of gray discoloration. And I'll just kind of highlight that for you as well. So these are pinpoint black discolorations. That's the 3rd most common lesion now. Okay, this is how exciting this is. So we got gray patches, gray target lesions, and we have pinpoint black discoloration. That's how technical we got. So that's what happens when you put 5 of us yahoos into a room together. It's the best we could come up with. So that's it, sort of just progressing. So again, sort of pointing on the right side. So these kind of often associated with rape marks too. So you can kind of imagine where our conclusion was with that, right? And they often had, more than 1 lesion occurring. So, and then erosions were kind of a rare findings. So these are actually depressions in the skin, well circumscribed, so good, margins were very well delineated, no discoloration from adjacent skin. So this is something we call erosions, and rather rare kind of disease. There's another picture of that. And then we have these things called cephalopod lesions. So that's where these kind of rows of dots, and they sort of start big and they get kind of smaller. So we kind of call them cephalopods because they, are they like squid or octopus kind of tentacles. We're imagining as little sucker marks going like across the body of the animal. So kind of rare, interesting, probably we think, associated with, hunting or capturing or playing with some kind of cephalopod. Humboldt squid are rather big and would fit with the size of this. And they're quite common, increasing number, and the animals will kind of play around with them on occasion. So that's what we thought was going on there. This one's super boring as well. So orange on gray, that's, again, how awesome was that naming? Like, how long did it take us to come up with orange on gray? So no idea what causes this. On occasion, we thought it was just the glare of the sun. But we do know that diatoms and skin diatoms have been described to kind of create a discoloration of gray, or sorry, an orange film or hue on Dall's porpoise and harbor porpoise, bottlenose dolphins, and some other species as well. So that's kind of what we think is going on there. So you can see that kind of orange on black there. And like I said, it's been. And then a couple of normal things. So calf epithelial sloughing. So these are young animals, and this happens in animals born in under human care. So we've observed this very frequently. And that's just young animals shedding a whole lot of skin. And this is focal and patchy erosive. It's hyperplastic. There's sort of ulcers and cleft formations you can kind of see. Looks kind of bizarro, but it's always young animals. And as the animals move through the water and they rub on things, that just kind of sloughs away. And it's just very normal kind of appearance, or a normal kind of growth kind of thing. You can kind of see as you date. So February 25th, nice and thick, right? And then a few weeks later in March, as the animal's growing, moving, that sort of smooths right out. And then the final thing are something we call fetal folds. So these are kind of folds in the skin, and those are associated with the animal just being in the uterus, bent over. And then as the animal stretches out through the birth canal and is born, those kind of little indents remain for a little bit of time as the animal progresses. So I can see these fetal folds. So we think that's fairly normal. Okay, so this is not a cool whale picture, so it gets even, can you imagine, even drier. But here's kind of where it sort of gets interesting, I said. So this is where we turn things over from the dumb veterinarians to the smart mathematicians, and we had the modelers look at the top 3 lesions, and you'll see that there appears to be a difference between the pods, right? So the pods are the different colors, right? So K, L, and J pod, okay? And what you see is that there's a difference between. So for example, the most common gray patches, the point prevalence is higher for K pods and the same for gray targets. But you don't really see a big difference by age or sex. So that's kind of interesting. But if you look at the black pinpoints, that's the bottom graph here. They're much more common in old males. So now you have an actual sex and age difference, and young females and young males, kind of like rake marks. So that's where the sort of association comes up with through the modeling. So a very similar distribution to rake marks, so probably associated with rake marks. And also from the photographs, it does kind of look like and rake marks, if you don't know that's when essentially they bite each other and drag their teeth across each other. It's sort of a social dynamic, sometimes for dominance, sometimes for scolding younger animals, that sort of thing. So you know, this this is science, so it is quite dry, and the big deal again, just going back to that whole idea of being a clinical veterinarian is we don't know what causes these things, but when you look at like the occurrence or point prevalence of all three lesions by pod, and time, there is a definite increase in gray patches, and gray target lesions over the past decade. So that's very interesting, right? And or decade and a half, I suppose. And then that becomes a bit concerning because we know about the same time these animals are not increasing in population. So they're struggling to find food, they're dealing with ocean noise, they might be dealing with contaminant levels. Those have been the top three potential causes of interfering with this group of animals' ability to recover their population numbers. So we don't think the skin lesions are the cause of the decline, obviously, but we think that the fact that they're increasing occurrence suggests that maybe the animal's immune systems may not be as robust as they used to be in prior decades. And I guess the next step for us is really to see if lesion prevalence correlates with individuals being thin, and there are ways to do that because we can take really good aerial photographs with drones now, and technology is getting much better. So the amount of stuff we can do from afar is getting better and better, or at least what we could do with hands off these animals. There's a lot more information that we get. So next step is really see whether it correlates with thin animals or other ways we can identify animals that are going to be dropping out of the population, and then seeing whether that it actually becomes a predictor of survival would be the next big deal. So a little bit of science, kind of where veterinary medicine and marine biology and free-ranging killer whales kind of intersect. The next study is, I think, a little bit more interesting, although it doesn't have to do with nice pictures of a live animal, unfortunately. So this was a necropsy that we partook in. It was with our clinical veterinary fellow, Carissa Tang, and our pathologist, Stephen Rafferty, Joe Gatos again, and myself. So this is an adult female offshore killer whale, and if you know how we kind of look at populations of whales and killer whales in our area, we kind of have three major groups or ecotypes, we call them, of killer whales. So we've got the resident killer whales, the southern residents, the northern residents. Those animals are typically fish eaters, particularly Chinook salmon. They're very dependent on. Then we have what we call transient whales, which are kind of slightly bigger, more fast-moving animals, and they're usually the marine mammal eaters, so seal, sea lion, occasionally sea otter, I suppose, and other whale eaters. And then we've got something called offshore transients or offshore killer whales. And they are very interesting because they eat elasmobranchs. They eat sharks and skates and stingrays. So very interesting kind of feeding strategy there again. So not exactly sure why all the different populations are so fixed on what they go after, because they are closely related, obviously. But it's thought to be an evolutionary tactic to divide up resources and prevent competition for resources between closely related animals. So severe tooth wear, because these guys are eating sharks. And I don't know if I guess not everybody gets to pet a shark, like I pet sharks and stuff. But if you've ever had the opportunity to pet a shark or stingray, they have a very sort of sandpapery skin. They've got these sort of denticles, which make up the skin, and very different from fish scales and the sort of bony fish. In the elasmobranchs and the sharks and stuff, that there's sort of modified teeth that just sort of travel and make up the surface of the skin. So they're very kind of rough and quite sandpapery. So the idea is, and this has been shown before, that these animals actually get a very high level of tooth wear and likely because they're eating and ripping apart sharks, which are wearing down their teeth faster than their southern resident cousins that eat salmon and their marine mammal eating cousins. So just to show you there. And that tooth wear has kind of been described, but never really had, found its hands into a bunch of veterinarians that love to grab things and image things and test things and send things out. So that's where this is heading. So the periodontal disease has not been really well described. So this is kind of us describing tooth wear and its potential relationship to mortality in a group of whales. And it sort of highlights why veterinarians are okay, I suppose. And I did forget to mention, but our veterinary dentist, Louis Chandra, was involved with this study as well. So since it's a dental study, I probably should mention him at the beginning, but anyway. So there's a full gross necropsy was performed, histopathology, which means looking at the tissue under a microscope at the microscopic level, obviously. We did detach the left and right mandibles to caudal to the dental arch, and then removed as much soft tissue as possible. Radiographs were taken, and that's the sort of just the technical details on how the radiograph was set. But we also did CT on the skull, and then the images were reviewed by radiologists and a dentist, an oral surgeon as well. So the the animal had severe muscle and fat atrophy. The gingiva, the gum of the tissue of the animal is very friable and necrotic. Some of it may have been postmortem change, but a lot of it wasn't. There was severe wear, and you can kind of see the wear of the teeth. There's an animal. These are worn teeth, right, exposing the pulp cavity and actually fracturing the tooth, as opposed to a healthy tooth on the bottom. So severe wear of the teeth and gingival margin, multiple areas of pulp exposure. Stomach contents had hardly anything in them except for a vertebral column and cartilaginous vertebral column, suggesting the animal had been feeding on sharks at some point, and some parasites as well. So histology, the gingiva was kind of too gross. Lots of other presumptive age-related pathology and did not, significantly contribute to mortality. However, the fun part here, the radiographic and CT findings, the crowns are worn down almost to the gingival margin. Many exposed pulp cavities, as was seen from the gross teeth I just showed you. Alveoli throughout were widened and irregular, so showing that the bone was actually infected and changing and quite serious, and that can be associated then with bacteria and infection leading into the bloodstream and potential for sepsis. And a lot of bony changes through the jaw itself. And then the pathology was more pronounced in the front, which is where they catch and kind of shred, as opposed to the back, where they would sort of more likely not do as much shredding. So sort of again correlated probably to something they were eating rather than a generalized infection throughout the jaw. So the cause of death was likely the animal just couldn't eat anymore, which is kind of interesting. So as a limit to population growth. Now, the offshore transients are actually not doing too badly. So they're at a population level, they're not limited, but it is interesting that what you eat or how you eat it might actually contribute to how long you might live. And dental disease is sort of quite interesting, really, especially in my world. In zoo and aquarium medicine, our world has really turned into geriatric and care and quality of life medicine. Is as we've all gotten really good at just providing basic needs for animals and knowing about their diets and social needs and behavioral needs. Animals are living a whole lot longer in our care than they are in the wild. So most of my clinical cases, particularly with our marine mammals, are dental disease, cataracts, arthritis, cancer, things that are just animals in the wild wouldn't have the opportunity to really get to because they wouldn't get to that age. But it is interesting that this particular group of animals is limited in how old they might get by what they eat. So that was that. The last story. Now, you guys, I probably tell me if I've been blabbing along too much, but last story is kind of a neat one to me, and that's really the story of our efforts to save J50, who was a young killer whale, and I think just a few years ago. I'd call J50 because she's part of the J pod, and was found to be in some trouble. So this was a multi-agency kind of effort. Not we were definitely involved, but there were so many partners on both sides of the border involved in trying to do the best they could for this animal. So government, aquariums, NGOs, governments on both sides, university researchers, etc., all kind of trying to put their heads together trying to save this whale. So if you don't know, that's a picture of J50 with her mom, taking us back to 2018. Scientists from NOAA, so on the US side, and also from the Center for Whale Research, identified that this 4-year-old whale, this juvenile young whale, named J50 or Scarlet, was losing body condition. And the way they could tell that is through a method called photogrammetry, and I'll show you how that works here shortly. Now, Scarlet had always been a little bit small for her age. She was described as having had a very difficult birth, and she'd always been a little bit stunted. But in this particular period of time, so through the summer of 2018, she was found to be incredibly skinny and losing body condition very quickly. Researchers who did get somewhat close to her found that her breath was quite fetid, and so this is how we kind of look at body condition in killer whales. So this is all J50. And there's a very specific technique that's done, flying a drone at a very specific altitude and taking a photograph at a very specific point in time as the animal's swimming, which offers a series of measurements which are then fed into a computer and come up with an algorithm then to assess body condition. And most of the measurements are sort of transverse right behind the neck here. So you can see as she's progressing, she's starting to get this indent. We call this peanut head. Now, something that drove me crazy while we're dealing with that is that people would say, oh, she's got peanut head, but she doesn't have peanut head. It's not a syndrome or disease. It's just describing emaciation. It's not a cause or anything like that. And people would, oh, she died of peanut head. Well, no, she was skinny and therefore she had this sort of peanut shaped head. But anyway, so here's the what they call the EP ratio that they get from photogrammetry, and essentially as her body condition, this is her here, falls down below here. Every other animal that had fallen below this measurement, this relative body condition score, had passed away. So we knew that the chances for her surviving were very, very slim. So for the first time ever, veterinarians a group of veterinarians was assembled to try and come up with a plan to treat this young killer whale. Now, going back to what I started with in the very first talk, as you can imagine, it is a little bit frustrating to try and treat an animal for an unknown condition, and administering things remotely for a condition that's unknown, and being limited by how much you can get into the animal in different ways. So I'll work you through the process, but the odds are obviously stacked against us to begin with. But this is the period of time we're dealing with this animal, and this was a meeting every night at 8 to 10, and then followed by observations. And so this was a huge effort by a whole lot of people for for many, many weeks to deal with this animal. So obviously we have some limitations there. So there was no appetite to try and actually catch the animal. It's just the political climate is not conducive to that. So there's no ability to form like a physical exam or do standard diagnostic tests that you'd want to do as a veterinarian or any sort of physician really. So what we had were some observations. So obviously we knew the animal was very weak. We started noticing that the animal was obviously losing body condition, but couldn't quite keep up with most of the animals. The animals would sometimes have to wait for her, or she'd catch up with them hours or sometimes days later. She would have to swim with her head held higher out of the water. That's sometimes in animals under human care. It's from animals start losing body condition. They also start losing buoyancy, so that they kind of push themselves out of the water to breathe. Just couldn't keep pace. Sort of fetid breath samples. So the assumption there was she was starting to become ketotic. She was breaking down fat and protein reserves and creating ketone bodies. There was some normal feces maybe that was observed by drone surveillance, and no evidence that the animal had been eating at all, even though other animals were observed catching fish and sharing food amongst themselves. So we did get a blow sample, and this is how we get blow samples from a whale. We can also use drones to do that as well. So it didn't have a whole lot of DNA, but there was some fungal organisms in there that were in that. But unfortunately, it's hard to tell what's in the what's coming up through the water or what's coming from the breath. Fecal samples were taken, but probably not actually from her specifically, but from other animals in her group. So there were, a bunch of different bacteria, Vibrio, Clostridium, Photobacterium, and some Contrasecum, which is a parasite. So those are the things that were found, not necessarily that they were cause of her problem, but things that were found in the limited number of diagnostic tissues that we could, or diagnostic methods we could use. So the orders kind of sent down to us were, what can you deliver to a killer whale at sea that will do no harm or has the least amount of harm, but might help, or might cure an unknown chronic condition. So again, stacks are kind of, the odds are stacked against us, as I said. So we know, from working with killer whales and similar animals and under human care, we know the kinds of bacteria and the kinds of problems that those animals can get associated with certain bacteria. And we know that bacteria possibly cause problems in stranded whales in the Pacific Northwest. That's through Stephen Rafferty at the BC Provincial Animal Health Center. And we know that what medications have been used in killer whales and dolphins. We're good at that. And now the way we could deliver meds to this animal, the only way we could do that, we can't shoot things IV, we can't deliver orally, but we can possibly deliver things in the muscle. Very limited by how much. So the darts are big, but for a killer whale, they're not that big, up to about 10 mils we can deliver into a dart. And we're also kind of limited by how often, because you can't see we don't get access to this animal very often. We're limited, well, just by the animal's availability, but also by boats and weather and people availability and everything coming together. So what we came up with was we could deliver an antibiotic, a specific long-term or long-lasting antibiotic that's used in a number of different species. Work with a veterinary clinical pharmacologist to develop to come up with an appropriate dosage for that, and we can load that into a 10 ml dart, and we can concentrate it so it'd be of sufficient concentration to actually have a clinical effect. And so we decided, well, an antibiotic, there are bacteria, and we can deliver an antibiotic. It wouldn't cause any harm, and it might just possibly do some good. And also, we might be able to deworm the animal. We don't think that parasites were the primary cause of a problem, but we know animals have parasites, and an animal that was already in very, very poor condition, if we can get rid of the parasites, well, maybe it would buy the animal some time. So these are the two meds that we kind of came up with and were allowed to give to this animal. So antibiotics and an antiemetic. And so this is how you deliver antibiotics to a killer whale at sea. So this is me. You'll hear me talking.
That'd be good. If that comes up again, I'll take it. I see her, I see her, I see her.
I have to repeat things 3 times for some reason.
They're right ahead, right ahead, right ahead. I see her patch.
And that's antibiotics.
It hit her.
Being delivered to a killer whale. So at the same time, as we were doing that, we did get 2 darts of antibiotics into her, and we also Joe did get a dart of ivermectin, the antiemetic, into her. So at the same time, some Lummi tribe folks, biologists, and tribal members attempted to feed live Chinook to J50. So they tried to get her to follow a boat and put live Chinook in her vicinity and see if they could A, get her to eat, B, get her to fatten up if she would eat, but also be able to give oral medicine if she would accept the food. But none of the animals, including J50, took any of the fish that were offered. So we did have some capture contingency planning. Eventually, it was fairly obvious that things might not end well. So we did have plans for bringing the animal to the Vancouver Aquarium and dealing with it. But the criteria for that were essentially animal on the beach or animals struggling so far away from other animals that it would for sure have no chance. So and part of the thinking there is they didn't want to disturb the other whales in an effort of trying to save this particular whale. So there was a lot of that going on, but as you can tell by my tone, unfortunately, things that did not work well. So she did continue to lose body condition, and she was last sighted on September 7th, and maybe September 8th was the last time. So, and unfortunately, when these animals do pass away, and particularly in poor body condition, they don't float, and we don't recover them. So. That is one of the frustrations. We don't really get to find out what's going on with them. So, but we did learn things, and that part's important. So there's a bright light here. There's at least a light at the end of the tunnel, I should say. And so we've got the expertise around, and was really great collaboration with the U.S. and Canada on the government level to bring people back and forth and bring drugs back and forth and allow people to work in international or waters of both countries. Lots and lots of organization, First Nations, government, NGOs, aquariums, veterinarians, biologists, pharmacologists, physiologists. Drone operators, you name it. The effort was pretty often, and I think one of the big issues was there are definitely different ideas and definitely perspectives, and maybe not all the ideas mesh, but nobody kind of working with the animal ever lost sight of kind of the bigger picture, which is this animal kind of represents a problem at the ecosystem level. And darting one animal with antibiotic isn't going to change things, but there are some bigger issues at play there, and so I've mentioned them before. So, interesting. We've been moving ahead since 2018. The drone stuff now is pretty incredible. So if I ever come back, I'll start to talk to you about all the stuff drones can now do and the types of samples they can do, and the information we get from drones is vastly improved from 6 years ago. And of course, at the same time that the veterinarians do their things working on individual animals and animal health issues at a population level, the marine biologists are working at ecosystem level things as well. So that's important. And then the last thing I'll show you is the big deal for me that came out of this was the appetite to allow veterinarians to treat free-ranging whales on an individual level. So a few years later, 2021, we're presented with Chocolate, who's a gray whale, who I'll show you, had a satellite tag attached. That's our team on a DFO boat. had a satellite tag attached to her, or sorry, him. This is Chocolate, on the American side by researchers, and that satellite tag caused a profound infection. You can see that satellite tag traveling through, and a massive amount of inflammation associated with that. So it was an infected animal. So now we had a clinical case, an obvious likely bacterial infection caused by human activity. So the appetite for doing something was dramatically increased. And that's where our team from the Vancouver Aquarium Marine Mammal Rescue came in. So this is us darting a gray whale. And so that's the dart during delivery. And they do feel it. This is from the drone. So you can see the animal reacting to it. And I think we'll see another, that's dart number 1. This is dart. We did deliver 4 darts. This is a much bigger whale, of course. So you can see the earlier dart, and this is the third dart. Actually, I think on this image you'll actually see some of the other darts still in the animal. There's one animal dart, and you'll see the second one coming. If you want to see that again, it's actually kind of cool here. So you can see the dart and the second dart there. So we did deliver 4 darts to this animal, and Chocolate. I'm gonna land this on a good note. Chocolate is doing just fantastic. So just wanted to say that things are progressing in a very positive way. Anyway, I just have to do a shameless plug here. So I am remiss if I didn't say that Vancouver Aquarium Marine Mammal Rescue Center is its own charity now, and always looking for support to help us do the work that I'm so very, very proud of. So shameless plug, that's us. If you want to visit the website and stuff, it's pretty cool. And with that, I'll answer any questions you might have. And I'm really sorry if I blabbed on too late and I've bored you all.
Well, you certainly didn't bore me. I'm not seeing more stuff on chat here. Does anyone have questions for Martin or comments?
It certainly wasn't boring. It was actually very informative, and I'm pleased to have learned that. You wonder what's going on out there. You see all of the activity, and it's hard to understand what some of it means, because it always seems like biologists are interfering with so many of the wild animals out there. But it's fascinating to learn more, and I thank you very much.
Oh, well, thank you.
We have more comments here.
There was a question on the chat here. I'm watching. Am I doing this work off Point Roberts? But no, I mean, the vast majority of what I do is not directly off Point Roberts. I just sort of live here. But yeah, there have been a few things off Point Roberts. And in fact, some of the last work we did with J50 was leaving from a boat in Point Roberts. So us at VAMMR cover the entire BC coast. So we respond to animals anywhere in British Columbia. And often the small ones are brought to our facility, of course.
Okay, I see some Lisa and Jono saying fantastic talk. That's good. And it was very interesting. And if anybody can catch those 3 documentaries, the Wild Pacific Rescue, they really are fascinating. I was quite taken with some of the efforts. When I saw you working with an ophthalmologist doing cataract surgery on a ringed teal, I couldn't believe it.
Yeah, no, that's Jackie Pierce. She's a phenomenal veterinary ophthalmologist in downtown Vancouver. And yeah, that's we've done cataract surgeries with her on all sorts of species, a snake, the duck, of course, lots of sea lions and seals. Yeah, she's great.
But I mean, a lot of the things that show up in that Wild Pacific Rescue are the results of things that we've done. You know, your bucket head, the silver sea lion with a plastic ring around its neck that's, probably kill it at some point if you don't get it off. And
yeah, some of the vast majority of animals that we deal with through the rescue facility have sort of direct human impacts, and many of them are sort of secondary habitat kind of issues and sort of urban wildlife type issues as well. There was a question here on the chat, which is, have I ever observed an animal with problems with satellite tags? Not really. Well, yeah, so there is a particular type of tag that's delivered with a crossbow to these large whales, and there have been quite a few reactions to those, and I'm not a huge fan of them. We place a lot of satellite tags on our seals and sea lions that are just glued to their hair coat or attached with a flipper tag that are a lot less problematic. But of course, with large free-ranging whales, it's a lot harder to attach those sort of things. Now, the information gained from those tags is pretty impressive, and has gone on to, declare certain populations of whales and endangered, and shown where endangered whales move. So it has changed shipping patterns and fishing patterns and stuff. So it is important work, but yeah, some whales have been negatively affected by those methods too. Yeah.
Mm.
Elizabeth, could I just ask, you mentioned, the doctor mentioned the possibility of speaking to us at some point at drone activity and how they're being used.
Oh boy, yeah, I regret saying that now.
Yeah, I think that would be very, very interesting future talk if you could ever arrange that.
I think I
Unfortunately,
As
Not-
well as learning how the satellite data is used.
And that would probably more of a sort of a marine biologist, ecologist type of person. And so there are folks that would probably be better at that. I'd be more involved with actually the methods of placing the satellite tags and sort of dealing with repercussions of them. Yeah. And as far as the drone stuff, the speaker you want for that is actually Joe Gatos. He's doing some great stuff on the just over the border on the American side.
Okay, well, we'll certainly keep that in mind for future talks. It would be very interesting.
Yeah.
Well, Anita's got a comment here. I'm appalled by what government is doing to our marine mammals in the name of progress.
Yeah, and that really, yeah, and I apologize. For the most part, our governments, on both on the American side and the Canadian side, have been doing some really good stuff, and the protections that have been offered to marine mammals have been phenomenal in rebounding. Our humpbacks have come back from the brink of extinction. Our sea lions are doing well. Our harbor seals are doing well. Our sea otters are coming back. So a lot of it are good stories for sure. But in order to do that, yeah, on very rare occasions, some of the methods we use to bring about better information does have an effect on the animals. Yeah.
Yeah, I think what Anita is referring to are some of the things that we're doing, like the second terminal at a port.
Yeah.
Oh yeah, no, you're absolutely right. Yeah,
That kind of so-called progress.
Sorry, I brought it right back to me because I'm a bit of a narcissist. But yeah,
No,
you're
that's fine. Okay, do we have any more questions or comments from anyone?
I just wondered how many.
I agree with Vicki 100%. It was very informative and very interesting, and not dry at all. Well, at least dry for maybe 1 second, and that was about it.
That's what I took a nap. Yeah.
No, that was very good. And we will make a donation to the Vancouver Aquarium in lieu of your honorarium.
Oh, that'd be awesome. Thank you.
Jim will look after that for us.
Much appreciate you guys.
Thank you very much, Martin.
Thank you.
Thank
Turn
you.
it back.
Have a good night, you guys. Thanks for inviting me.
Thank you.
Bye now.
Thank you.
Bye.